We organize in collaboration with the renowned scientists and recognized experts like Dr. Abdul Malik, are to enhance scientific knowledge and enrich expertise of the concerned staff, and to exchange knowledge also to benefit from each other, learn this in the field. So such awareness activities, we endeavor actually to significantly impact the future of camel farming in the Arabian Gulf and entire region of the Middle East. Our topic today is about the camel calf diarrhea, which is not a single but multifactorial disease entity. It is a clinical syndrome actually associated with several diseases and manifested clinically by profuse diarrhea, altered fluid absorption, and with life-threatening electrolytes imbalance. And it's a cause of severe economic losses and burden due to loss of young animals. Affected calf also develop acidosis, and with the greatest losses occurring when calves are kept in close confinement, where the transmission of the causative agent is enhanced by their buildup in the environment, causing, as I said, financial and animal welfare implications. Our speaker today, Professor Abdul Malik Khalafallah, will share his experiences and provide comprehensive overview, including etiological agents, along with epidemiological aspects and diagnostic procedures, and also dynamic determinants of the disease. Special emphasis, I think, will be on the improved management and control practices towards reducing the prevalence and lowering the source of infection, and consequently, the losses precipitated by the disease. Prof. Abdul Malik is currently an expert and consultant in the veterinary microbiology at ADAFSA Veterinary Laboratories at the Biosecurity Affairs Division, which is a WOAH collaborating center for quality management in veterinary laboratories and also in camel diseases. Prof. Khalafallah has amazing professional track record and achieved many accomplishments as a scientist specialized in camelids. To know few, he is a WOAH participant expert in 3 ad hoc groups of camel diseases. He has a magnificent scientific contribution with over 100 published articles, several book chapters, and a book on infectious disease of camel, Spring Nature. He was the director of the Camel Research Center in Sudan, 207, and chaired the ISOCARD, the International Society of Camel Research and Development, from 2012 to 2015. That's the view of Dr. Abdul Malik, actually a very rich record. Before I give the floor to Dr. Abdul Malik and Professor Abdul Malik, I invite you to take a group photo for the event, so as for the memory of this webinar. And I hope that you will interact with Dr. Abdul Malik, and also our colleagues can reflect their clinical experiences with the disease. Thank you. Mahdi, you are now you can deal with the group photo.
Yes, I will take the picture in 5 seconds. If anyone wants to open his camera to be ready, thank you.
Those who wish to open their camera, of course. That's for our records.
Done. Thank you very much.
Thanks, Mahdi. Now the floor is yours, Professor Abdul Malik. Go ahead with your presentation.
السلام عليكم رمضان
عليكم
كريم.
السلام. وعليكم السلام ورحمة الله وبركاته.
Good morning and Ramadan Kareem. And welcome to this webinar on an overview of neonatal camel calf diarrhea, economic burden, etiology, and lab diagnosis. Can you see my screen?
Yes, Admiral. It is clear, but it's not in the presentation mode, but it is clear. It is seen clearly.
Okay, before I start, I would like to thank the WOAH sub-regional office in Abu Dhabi for giving me this opportunity to talk to you in this morning about an important disease of camels. And particularly, I would like to thank my colleague, Dr. Tariq, and also Mahdi, in addition to the director of the sub-regional office, Dr. Muhammad Al-Husn. And then welcome to all of you to this webinar. I should also mention that or to thank again the sub-regional office for their effort in the knowledge transfer, and in particular with regard to camel diseases, which are important, the camel in this region of the world. So are it in the presentation mode or still? Tariq?
It is not actually it's in the presentation mode, but if you cannot shift to the presentation mode, it is clear.
I already asked my slow computer to do it. What about now?
Yeah, it's fine. It's clear.
Okay. Then one should ask, what do we mean by neonatal camel diarrhea? Of course, it is calf diarrhea, which is also important in other livestock species like sheep, goat, and cattle. And it is, again, a multifactorial, serious, and economically significant disease affecting young camel, Heran, singular Esquar. And of course, it is characterized by loose or watery feces. And most important is that the diarrhea decreases the absorption of essential nutrients from milk and leads to three most prominent effects. One, weight loss. Second, severe dehydration and electrolyte imbalance, and death. And as you know, bacterial fermentation in the gastrointestinal tract produce lactic acid, causing acidemia, and this is electrolyte imbalance, accompanied by systemic signs of weakness and ataxia. With regard to the economical significance of neonatal calf diarrhea, camel calf diarrhea, the prominent effect is the mortality. Mortality rate in camel population, and we'll see that in the coming slides how much mortality the calf scour can cause. But one important economic effect is the mortality. But the most, also the second most important effect is the reduced productivity and income for camel herders. Here, I mean, once the she camel lost their it is calf, then it will cease producing milk, because as you know, in camel, which are mostly raised in traditional systems, they when they lost the camel calf, then there will be no more milk, and then the economy of the population of the herder will be affected. And then with regard to the overall or what is written in the literature regarding the economical impact, according to Schwartz and Yuli, they have a book on camels, and they estimated that the calf diarrhea that caused mortality of up to 30%, and mortality which can reach 100%. According also to another report, the calf diarrhea caused about 33% of mortality and 23% of mortality. So generally speaking, the morbidity is around 30%. This is a case of neonatal camel calf diarrhea. The picture was taken from Al Qasim in Saudi Arabia. And here there is this is about a publication from Sudan from 1991 to 1992. And as you can see in this table about the mortality among camel calves in 15 herds in Butana area of eastern Sudan. As you can see, they put calf diarrhea as number one with a percentage of morbidity of 30%, much higher than most of the camel diseases, including tick paralysis, snake bite, camel contagious eczema, and unknown causes. This is another publication also from my team that was a long time ago, 1990, which was 95, 99, which was published in 2005. With regard to the epidemiology of camel calf diarrhea, in a total of 383 camel herds, the overall morbidity rate of camel calf diarrhea in 4 areas was 83%, and the mortality and the mortality and case fatality rate was were 40% and 43% respectively. This show how neonatal camel calf diarrhea is a very important and serious cause of disease in the traditional areas of production. And with regard to different treatment, they mentioned that like 60% of the cases receive antibiotic treatment, but like 40% of cases were left without treatment. And treatment include, in addition to the traditional treatment, also giving antibiotic treatment. With regard to the type A rotavirus, they detected overall percentage of like 50%. This is another recent publication from Ethiopia, and the title is Participatory Epidemiology on Major Camel Calf Health and Management Problems in Pastoral and Semi-Pastoral Zones of Somali region, Ethiopia. And as you can see from the table on your left side, they put the diseases with their rank. And as you can see, calf scour or calf diarrhea is having rank number 1. It's number 1 important disease in the study area. And here on the right side, they put information about the prevalence based on age, sex, or region. Now, with regard to the causes of neonatal camel calf diarrhea, as I mentioned, it's a multifactorial disease. caused by viruses, bacteria, and protozoa, in addition to non-infectious causes. So with regard to viral infections, we have rotavirus, number one, which accounted for almost 99% of the viral causes. We have also coronavirus, but in the future there is no much reports with regard to coronavirus infection. In Camel, only one publication from USA. Although when I visited Al-Salam Hospital in Al-Qasim, and by the way, this presentation was also presented at that training workshop in Al-Qasim. We selected Al-Qasim, the Al-Salam Hospital, because they have a very nice section for neonatal camel calf diarrhea, and they developed their own protocol for diagnosis and treatment, and they have very interesting and complete setup for treating neonatal camel calf diarrhea. So at Al-Qasim Al-Salam Hospital, they told me that by the rapid test, they detected one case of coronavirus. However, with using this rapid test, which is not, highly sensitive, there is a doubt. But anyway, overall, I must say that information about neonatal camel calf diarrhea is very limited, and we urge scientists to study neonatal camel calf diarrhea, as I will mention later. Back to the causes. As I mentioned, we have rotavirus infection. And with regard to the bacterial infection, mostly we have Escherichia coli, Salmonella species, Clostridium perfringens, and so many other bacterial causes, but these are the main bacterial causes. With regard to the parasitic protozoal infection, we have Cryptosporidium, Giardia, Coccidia, and Isospora. So this is a publication from Saudi Arabia, where they study neonatal camel calf diarrhea in the north province of Saudi Arabia, Al-Jawf area, and they reported camel calf diarrhea in 184 out of 2,304 camel examined clinically during a 1-year period, and they found that the neonatal camel calf diarrhea is found in 80% of calves, and that the causative agent include group A rotavirus, in addition to Brucella abortus, E. coli, Salmonella, Enterococcus. Although I have consideration about Brucella, because it's not known to cause neonatal calf diarrhea, but they detected this bacteria while they're looking for causative agent of neonatal calf diarrhea. Anyway, okay, and again another publication by my team in Sudan, and this is about rotavirus associated camel calf diarrhea, and they in 245 diarrheic samples, and some recovered camel. These are the samples collected from camel with diarrhea were tested by different techniques targeting rotavirus infection. This is just to show you that how wide and varying the techniques that can be used, including ELISA kit, as well as the latex agglutination test, in addition to polyacrylamide gel electrophoresis and electron microscopy. So by this, they detected 46 sample positive for group A rotavirus, accounting for 14%. And these are the techniques that were used to diagnose the cases. In another publication also from Egypt, they also isolated and molecularly characterized J10 group of group A rotavirus infection in camels in Egypt. But as I mentioned, generally speaking, we have very limited publication with regard to neonatal camel calf diarrhea. Here, I just wanted to say that, in summary, several enteropathogenic pathogens are associated with diarrhea in neonates. The relative prevalence varies geographically, but the most prevalent infections in most areas are enterotoxigenic E. coli, rotavirus, corona, and cryptosporidium. And then cases of neonatal camel calf diarrhea are commonly associated with more than one of these agents, so that it's sometimes there is multiple infection, meaning that you can get salmonella in addition to, for example, parasitic infection, E. coli mostly with rotavirus infection, and so on. And again, with regard to the quantitative agent or predisposing factor, they found that administration of giving antimicrobials such as neomycin or tetracycline to young calf can result in villus changes in the villi of the intestine, with that result in malabsorption and mild diarrhea. Also, prolonged administration of antibiotic treatment also can lead to diarrhea. And we have also predisposing factors, such as inadequate nutrition of the pregnant dam, inadequate environment for the newborn. For the dam, of course, you can connect between having a very good or healthy pregnant dam and the health of the offspring. Quite evident, because the transfer of immunity is, in this case, will be transferring very good immunity to the calf. Inadequate environment for the newborn, dirt in the pens, also inadequate colostrum ingestion, and this is because the colostrum is full of immunoglobulins that protect the calf from getting infected with pathogens. Inadequate immunoglobulin absorption, because it's not only from the side of the pregnant dam, or not only from the she camel, but also something related to the calf, inadequate immunoglobulin absorption for different reasons, sometimes genetic. Poor hygiene and overcrowding in the area is quite evident, mixing of different age groups. Okay, we have also non-infectious contributing factors, and it includes in details poor colostrum intake, not only quantity, inadequate quantity, and or quality. Quality meaning the content of the immunoglobulins in the colostrum. So that we need high quality colostrum. This is particular for the camels, because they are born very, very weak. At least we need to have IgG immunoglobulins of 50 gram per liter or more. So the quality and quantity of the colostrum fed, also the timing of feeding is important, and the keenness of the colostrum are important. I mean, meaning that the colostrum is not from other that having mastitis, for example. In addition to overconsumption of milk is causing also diarrhea, poor sanitation, stressful environment, condition like cold weather. If you look at this picture, this is in the winter. So unless you protect your heron from the cold, you might get this kind of neonatal calf diarrhea because it's the stress factor. Okay, with regard to the clinical signs, it's quite easily to recognize, mostly watery loose and loose stool, dehydration, of course, and then followed by lethargy, sunken eyes, dry mucous membrane, weight loss and reduced body condition, electrolyte imbalance, that I mentioned before, because of the lactic acid, and then you have accordingly muscle weakness and tremors, and then you have also anorexia and decreased appetite. In some people used to divide or to categorize neonatal camel calf diarrhea into forms. Although I'm not, 100% in agreement of this kind of having forms, but it's good to have to present it to you. So they categorize the neonatal camel calf diarrhea into three forms. Form 1 that occur at the age of 1 to 7 days and manifested by whitish fetid diarrhea with bad smell, severe dehydration, anorexia, and this is mostly caused by E. coli and rotavirus. Form 2 is between 2 weeks to 2 months. It manifested by abdominal pain, inhabitants, emaciation, and diarrhea, which may contain some blood. So this is why the causative agent may be Coccidia, Clostridium, Campylobacter, Salmonella. And then form 3, which affect camel calf at the age of 2 months to 1 year, that manifested by gastroenteritis, animal are dull, with pale mucosa, pneumonia, diarrhea for brief period. And this is mostly caused by Salmonella species. Very important is to assess the level of dehydration in case of diarrhea, camel calf diarrhea. So they put a percentage for the dehydration. So in case it's from 0 to 5%, this is no problem. There is no symptoms of diarrhea. Animal is normal. When the dehydration is above 5 to 6, you have diarrhea. There is no clinical sign, a strong suckling reflex. And then when it increased to from 6 to 8%, you have mild depression, skin tenting. Skin tenting means when you pull the skin from near the eye or from the neck, it will not come back to normality. It will come back to normal in 2 to 6 seconds. And still the calf is suckling, but you see the eyes are going down, sunken eyes, and it is weak. And then when it is increased, the dehydration to from 8 to 10%, then you have depressed. The calf is depressed, laying down, eyes very sunken, dry gums, skin tenting for more than 6 seconds. And then if it move, or the dehydration move from 10 to 14%, the calf cannot stand. You have cool extremities, skin remains tented, and you have coma. And if it's move above 14%, normally it leads to death. So can I ask question? You have this picture of the calf on your right side down. From your point of view, how much is the dehydration level? If you look at this camel calf on your right side down, this is from Salam hospital in Al Qasim, and this is something like 8% dehydration. You need to do so because these information are very important for the prognosis of the disease and also for the treatment. So now we come to
excuse me, Prof.
Yes.
Get back to the picture. Is the calf here recumbent and cannot stand, or it is just like?
Yes, we try to no, it can stand. It can stand.
Okay.
So it's not emaciated as to the maximum. It is yes. It is I can say it's from 8 to 10%. It's depressed, laying down, and I have we examined the eyes sunken, and skin tinting also is quite prominent. So I give it 8 to 10%. If it's still like this, and then lose more water and electrolyte, you can go up to 14 or 10, and then may die if there is no treatment. Now, with regard to the diagnosis, as you know, clinically you can diagnose neonatal calf diarrhea. There is no problem at all. When you see watery and loose stools, that's all. And then you need to assess dehydration, as I mentioned, and the body condition and other signs. Then just to confirm the clinical diagnosis, you go for laboratory diagnosis, not only to confirm, but to know what is exactly the causative agent in order to prepare your treatment. So what you do fecal examination, microscopic examination for the parasites and bacteria, and or you take sample and send to the laboratory, and sometimes you can do the lab tests at bench site, like the rapid immunochromatographic test. So if you send a sample to the laboratory, they will do culture, fecal culture and sensitivity for bacteria and even virus. They must do also PCR for viral and bacterial pathogens, and they can also do ELISA for specific antigens. Also, they can do electron microscopy if they have electron microscopy. And the picture on the right side bottom is our picture that for sample collected from Sudan, and this was tested by electron microscopy. And if you can see in the picture, there is a characteristic wheel-like structure of the rotavirus. So by the electron microscopy, you can differentiate between corona and rotavirus infection quite easily. But the test, as you know, is not available where camels are raised, and it's costly. And in addition, you need a high concentration of virus in your sample so that you get a positive result. So this is why people are normally go for a rapid test. And this is one of the rapid tests that are being used in Saudi Arabia, and in particular in Salam hospital in Al Qasim. They use this Bionot rapid test kit, and this is how you take your sample. So there is a swab, you take a swab from the rectum, and then you need to put this swab in a solution, in a buffer. You mix well, and then you take the suspension of the feces, and you put in the cassette. And this is a cassette which contain the section where or area where you put your sample, and there is a filter paper through which the solution being absorbed and until it meets with the reagent that are put the antigen, the control, and then you read the test in 10 to 15 minutes. And this can be containing not only one pathogen, it can also contain, like this one, COVID D6 antigen. It can detect Cryptosporidium, it can detect rotavirus, coronavirus, E. coli, Giardia, Clostridium perfringens, alpha toxin. So you put one drop in each slot, and then you wait for a while. But please remember, this immunochromatograph assay is designed for bovine. Is not validated for the camel, and this is an area where our collaborating laboratory in Abu Dhabi should work on having tests that are validated for camels. What I mean by validated, that are tested several times to know how we can use the test for camel samples. But it works. This one it works, and it can give you a result for rota and even corona, E. coli. But as you can see, there is no salmonella, which is important. And also the other pathogens, they are not included. But anyway, it is been, and again, it is costly. I think they mentioned for me, for one animal, it costs you like 20 riyals. Anyway, now with regard to the biochemistry, you need to take sample and test. But most important for the biochemistry is to that the blood pH, not only the blood pH, but bucket cell volume is high in acute diarrhea, and the protein is also high, and then the sodium and the chloride are less, while the potassium are higher, and blood urea nitrogen is high in case of acute. This can aid you in your diagnosis and also assessment of the dehydration and electrolyte imbalance, so that you treat accordingly if you need sodium or you need chloride. Anyway, here in the lab, if you want to isolate or diagnose the cases of E. coli, you take 1 gram of fecal samples and inoculate buffered Peptone water and incubate at 37 degrees for 18 hours. The next day, you also loop full of enriched inoculum will then be bled into eosine methylene blue agar EMB or McConkey. In the EMB agar, you see metallic green sheet. This is E. coli gross, while in McConkey you will see pink colored colonies. With regard to salmonella, also what you need is to enrich the sample by inoculating in media like buffered Peptone water, and then you use selective enriched media like Muller-Kaufmann and VSB via RSV, and then subcultivation on XLD agar and brilliant green agar. And in the XLD agar, you will see red, yellow with black center colonies. And in the VGA, you will see red to pink white colonies surrounded by brilliant red zones. Now, with regard to treatment of neonatal calf diarrhea, according to what I mentioned before, you should think about oral rehydration to help restore fluid balance and the loss of electrolyte and essential nutrients. I don't want to go in details to mention the medicine that you should use. They are available, but just to have an idea what to do, you need to intravenously inoculate fluids to correct dehydration and electrolyte imbalance. And then you need, according to the culture, antimicrobial therapy in bacterial scours cases. Oral or injectable antibiotic therapy may be advised, but again, based on the culture and sensitivity, so that if you know that it's E. coli or Salmonella or other bacteria, according to the sensitivity, you prescribe your treatment. Supportive care provide warm and comfortable. Monitor vital signs closely. And by the way, this is a Rashida, people in Eastern Sudan, they used to drench what is al-garad. Al-garad is acacia fruits. It's garad in water. They said that it's very, very effective. It's antimicrobial component. They said that it's very effective for treating neonatal camel calf diarrhea. For prevention, you need good hygiene practices, clean and disinfect calving area, proper disposal of manure, colostrum management, and then ensure prompt and adequate colostrum intake. To test colostrum quality for antibodies. Here, when we were in Salam Hospital, they said that there is a small device that you can use to measure the quality of the immunoglobulins, the antibodies in the colostrum. So from the dam, you take sample and then test. If the immunoglobulins are less, you need to make a change, either to add them colostrum from different mother, or you use this kind of commercially available product for that contain immunoglobulins. So sometimes you may use vaccines to protect against specific pathogens. And by the way, they tried, particularly in Saudi Arabia, they tried several vaccines. And then you need a nutritional management and provide a balanced diet to support immune function, stress reduction, minimize stress during transportation and weaning. Here, these are the vaccines. The vaccines are targeting the causative agent. It contains, for sure, rotavirus, E. coli, and Salmonella, as you can see here. And again, the same issue that these vaccines are designed for cattle, not for camels. So, but they are used successfully in camels, in particular, I don't know here in United Arab Emirates, but they are being used in Saudi Arabia. And the procedure is to immunize the pregnant dams. The aim is to increase the host immunity and reduce the load of infectious agent in the environment, prepartum vaccination of them is one of the main strategies to improve the host immunity, to increase the concentration of specific immunoglobulins in colostrum and provide passive immune transfer to the offspring, to الحيوان. Vaccination also decreases the need for the use of antibiotic, which in turn reduces the risk of antimicrobial resistance. They said they work very effectively, but we need more research on this area, and we need to work hard on determining the exact pathogens that are causing neonatal calf diarrhea, and then design vaccine based on the vaccine, the isolates of bacteria or viruses that were isolated from camel cases, not from cattle, in order to develop a vaccine that is uniquely adapted to the camels. So the way forward with regard to neonatal camel calf diarrhea, as I mentioned before, there is a very limited information about only, as you can see, only we have one publication from Saudi Arabia about neonatal camel calf diarrhea. Here from United Arab Emirates, I couldn't find any publication. And from Sudan, long time ago, even we published as I showed to you. But generally speaking, there is a lack of information about neonatal camel calf diarrhea. Tariq can, take a note that for his office and for CAMENET, and even for us in the Collaborative Center on Camel Disease, we need to work on neonatal camel calf diarrhea to determine economic impact of the disease and its epidemiology, as well as to determine the role played by each pathogen up to strains and genotype. I mean, for example, if it's caused by rotavirus, which group, which genotype, and then virus and bacterial isolation to isolate the rotavirus, E. coli, salmonella, the other causes agent. And then from this, after this, we can look at developing vaccine for single pathogen and for combined vaccine. And then vaccine evaluation, and then vaccine production and commercialization. We cannot depend upon testing, or also we need to work on the diagnostics, because we cannot rely on tests and methods, as well as vaccines that were developed specifically for cattle or sheep and goat. And for example, this is a publication also from my group. We determined the genotype of the rotavirus from Sudan, and it turned to be an African camel rotavirus strain. This is the name of the strain, J4P. So we need to do this kind of investigation to determine what genotype of rotavirus that are circulating in the Gulf or in the United Arab Emirates or in Saudi Arabia. These are the references for my talk. One of them is the book, Infectious Disease of Dromedary Camel, also available. Any one of you who want a copy, it's electronic copy I have. It's freely available. And these are another publication. As you can see, we have only very few publications. So that is all about the presentation. Is just an overview of the disease. I didn't want it to go deep into the diagnostics or the treatment, the treatment is quite very complicated. Very complicated. I mean, you need to evaluate the level of dehydration to prescribe the best and good, and even you need to calculate the weight, and then you calculate the amount of the electrolytes you want to give. You need to calculate to test the dam colostrum to see if it's the quality of the colostrum is good, or you need to give immunoglobulin. And by the way, there is so many immunoglobulins commercially available in the market, and the people from the Al-Salam group, they said they told me that they are, most of them, they are very, very, very effective. And there is some knowledge and experience that all of you need to listen to them. People in the Salam hospital in Al Qasim, they are knowledgeable about. They have, as I said, a very good facility. They have a section, very big section, just dealing only with neonatal camel calf diarrhea, and they follow your calf from when you bring it, and then they can also follow your calf until up to 2 years of age. They provide treatment and nutrition for the calf according to their knowledge and calculations. And they develop techniques to, as I mentioned, evaluate the health condition, and then also to give the best treatment. And they mention also, sometimes if you have a very good dam, you can take the blood and then collect and then separate the serum, and you can store this serum just in case you face neonatal camel calf diarrhea. You inject your calf with this serum, which is heavily having very good amount of immunoglobulins. So that is all. Maybe the question may open the way for more discussion. Thank you very much. It is Ramadan, and I spent nearly an hour.
Thanks, bro, Abdul Malik, for walking us through this wealth of information. Indeed, as you said, information about neonatal camel diarrhea is scant in the literature, which dictates or necessitates more carefulness and more efforts and more resources to be devoted to this important disease, which is causing massive losses and also can affect the camel raiser all over the region. I have one question here regarding that. During your talk, you said that you encountered Brucella, which is something not usual. But I think is it we can say that this is part of the microbiome of the disease in this. Because microbiome, as I know, it is a community of microorganisms that can be found in the certain environment, and but there is no any further comments on that. You didn't encounter any further comment about encountering Brucella within the causative agent of camel calf diarrhea agents. And also, I need to highlight also the experience of a Salam hospital. I think last year workshop on camel calf diarrhea need to be repeated, and success the hospital achieving in dealing with camel diseases, particularly camel calf diarrhea, need to be replicated in other part of the countries, and also the scientific community who is working in camel diseases need to unify efforts to develop protocols and also procedure and also for the treatment to at least to minimize the losses for the. Thank you, and the floor is open for our colleague for questions. And you are welcome to discuss your own experience, clinical experience with the disease, and to show us how you deal with it and what lesson learned. Right. Thank you, Abdul Malik, again, and the floor is open for our colleague to interact.
Tariq, if you let me say something.
Yeah,
With regard to Brucella, it's just mentioned in the publication by our colleagues from Saudi Arabia, from Al Jof University. They detected group A rotavirus, E. coli, and other bacteria, and they mentioned Brucella. Of course, as in my presentation, it's not included as one of the causative agents. I mean, Brucella is not one of the causative agents of neonatal camel calf diarrhea. We have only mainly E. coli and Salmonella, in addition to other bacteria, but not Brucella.
No, Professor, I didn't say it is of course, but it is present there within the.
Yeah, they publish
as
what
a contaminant, as a contaminant.
Yeah. Maybe it's just they publish what they found, and they found Brucella. They put it in their publication that we detected Brucella.
Yeah, clear now. And regarding the response of the diarrheic calves to the treatment, is there any individual variation and is there any factor affecting the response? I think as far as I know, it is composed of antibiotherapy and fluid therapy, which is directed towards the causative agent. But is there any variation of the response or of the affected calves, or it always react as expected? Yeah, they are recovered and being rehydrated and treated.
Well, the only difference is the with regard to the response to treatment is the severity of infection or the level of the dehydration. Once the level is going beyond 10%, then it is the prognosis is unfavorable. But if the owner bring his calf earlier and there's only signs of diarrhea as in the first picture I show here, is still this calf is still suckling. Although there is diarrhea is coming and it's yellow in color, but it's still suckling and standing up. So in this case, the treatment can be very effective. But when the eye is sunken, when there is the animal cannot stand, then it's always difficult. But you as a veterinarian, you should think first about the electrolyte imbalance. So, because it's acidic, you need sodium bicarbonate treatment as early as possible, even before the electrolytes, the other electrolyte, because this is most important, the electrolyte balance. And then you add all these, minerals, and then you look at the antibiotic. Don't just inject an antibiotic and you think that you can treat, successfully. Treat symptomatically and give the priority for electrolyte imbalance and dehydration. And then depending on the severity of infection, you might get a very good result. at early stages.
Yes. Thanks, Prof. The floor is still open for comments from our colleagues, and it is welcome. Any one of them have any interaction or comments? As you said, Prof. Abdul Malik, that one of the effective treatment methods is to immunizing the dams before is this measurement um, uh, could be assessed in is there any studies or statistics that for the calves from vaccinated dams are not severely exposed to the area despite the disease is prevailing in nearby countries or farms. Is there an assessment for that, or it's just based on the science facts that if immunized dam produce rich cholesterol with antibodies, it can confer a good level of immunity to the cows. But
Tariq, according to our colleague from Al-Salam Hospital in Al Qasim, they claim that the vaccination is good, and it gives a very good result. However, we cannot depend on just such saying. We need to have well organized research in a controlled environment, in a very good experimental platform. You give this vaccine in a different doses using different vaccines, and then you assess the immune response, and then you challenge the animal, the young, the offspring, the heran, by pathogens. Unless we do research and then publish the results, we cannot just claim according to the knowledge gained by our colleague in Al Qasim. So generally speaking, I cannot say that the vaccination against neonatal diarrhea is successful, or I cannot recommend even, because it might be that the vaccination is causing side effects. Nobody knows. So we need to invest money to do research in vaccination against neonatal diarrhea, or vaccination against any pathogen that causes disease in camels in general.
Yeah, sure, Professor Abdul Malik. The floor is still open for our colleague to interact also and to listen from their experiences. And
if there is no more comment that they are happy because about the presentation and because of Ramadan, and it is time. This time is very difficult. People are leaving their home, their work for home, for shopping also. So let finalize.
Okay. With this, we conclude our webinar. We wish that it is informative and you are benefited from the rich information provided by Professor Abdul Malik. And again, we thank him for his patience and his effort, his cooperative spirits with the office, and looking forward to have you with us in more webinars and more scientific discussion. And Ramadan Kareem. Goodbye for this. Thank you.
Bye. Shukran.
شكرا لك عبد الملك. شكرا.